The following is a case study of a patient who had a successful outcome in managing her rheumatoid arthritis pain following a DNAdose test. Our consultant pharmacist, Mr. Sam Mustafa, will present this case for you.
This case study is about a 50-year-old female suffering from rheumatoid arthritis for a number of years. She is on multiple medications, including a couple of analgesics, tramadol and penadine forte, which contains paracetamol and codeine. Both analgesics are used for the management of her rheumatoid arthritis pain. Despite the use of multiple analgesics, she complained that her pain relief was never optimal. She is also treated for depression with the SSRI antidepressant sertraline. I will explain shortly why this is of importance in her pain management. The treating GP requested a DNAdose test to evaluate the function of some of her CYP450 enzymes, which may give an insight into the reported lack of pain relief from multiple analgesics. The test results showed that she had a 50% reduction in the CYP2D6 enzyme function, which in fact plays a crucial role in activating both tramadol and codeine. This enzyme is also important in the metabolism of approximately 25% of commonly prescribed medications. The other test findings were that this patient also had a significant reduction in enzyme function for both CYP2C19 and CYP2C9. Codeine and tramadol are both prodrugs and are converted into their respective active metabolites by the action of the CYP2D6 enzyme. It is these active metabolites, morphine and O-desmethyl tramadol respectively, that have the analgesic effect. Due to the reduced CYP2D6 enzyme function, this patient will have reduced activation of codeine and tramadol, and hence reduced analgesic effect. As you may recall earlier, we mentioned that this patient is also taking sertraline for the treatment of depression. Now, sertraline is a moderate inhibitor of the CYP2D6 enzyme, and therefore it is predicted to further reduce the CYP2D6 enzyme function from 50% to possibly none, making this patient a poor metabolizer. This inhibitory effect of sertraline will further reduce the bioactivation of codeine and tramadol, resulting in minimal analgesic effect. Furthermore, the parent compounds codeine and tramadol accumulate as a result of reduced 2D6 metabolism. This results in increased risk of side effects such as drowsiness and constipation. There is also an increased risk of serotonin toxicity with the combination of sertraline and tramadol, as both are serotonergic agents. Based on these findings, the DNAdose report recommended the use of morphine, hydromorphone or buprenorphine for this patient as clinically applicable. The prescribing doctor decided to switch the patient to low-dose buprenorphine transdermal patch. We followed up the patient a few weeks later and received very positive feedback. 1. She had significant improvement in pain relief as a result of starting the buprenorphine patch. 2. She is now sleeping better, is experiencing minimal side effects, and has stated that this has immensely improved her quality of life. For more information about the test, or for more case studies like this one, please visit www.dnadose.com.au.